Welcome back to Better Health for a Better World. In this episode, we dive into the vital intersection of health and nutrition with a focus on Ethiopia. Our expert guests will discuss how nutrition and health are intrinsically linked and how collaboration and partnership are vital in improving both health and nutritional outcomes in Ethiopia. We will also hear about the importance of strengthening systems and how encouraging healthy eating behaviours is not enough without improving access to affordable, healthy foods. Today we have three incredible guests joining us. Nicola Brennan, who is the Irish ambassador to Ethiopia with responsibility for South Sudan and Djibouti. Mary McGrath, who is technical director at the Emergency Nutrition Network. And Dr Yared Abebe, who is the senior health and nutrition advisor at Save the Children Ethiopia. You're all so welcome to the podcast today. Perhaps, Nicola, I might start with yourself and just ask you if you could help us just set the scene a little bit about Irish Aid's work in Ethiopia. You know, some background, some history of the partnership, some of the priorities where Ireland is working with Ethiopian counterparts.
Great, Nadine, and really great to join the podcast. So well done to you and your team for another opportunity to talk with you about better health for a better world. So we're really delighted to join. I'm delighted to be Ireland's ambassador here. I've been here for 3 years now, and we will be celebrating 30 years of diplomatic relations with Ethiopia next year in 2024. So we opened our embassy in 1994. But the relationship with Ethiopia goes back even longer to that. And it'll be, I hope, of interest to many of the listeners that in 1935, when Emperor Haile Selassie stood up at the League of Nations in Geneva to request support against Italian aggression towards Ethiopia, our then President Eamon de Valera stood up in support of Ethiopia. So it's really incredible to go back that far and to see that history and that relationship emanating since then. And I think many of your listeners will also know of Ireland's support in the mid-1980s to Ethiopia when it suffered a very severe famine in the north. And coming from our own history and background of famine in Ireland in the 1840s, the mid-1840s, that history still resonates very much today with the Irish government's response to hunger, to nutrition. And during that time in the 1980s, when Ethiopia had a severe famine, we couldn't sit by, and we came and provided a lot of support to Ethiopia at that time. But as I say, fast forward to the present day, as you highlighted, the embassy is also accredited to South Sudan, Djibouti, and the African Union, the Intergovernmental Authority on Development, and the UN Economic Commission for Africa. So we have a very big and very busy embassy covering quite a lot. We manage the Government of Ireland's biggest bilateral assistance programme in the world. So Ethiopia is in receipt of 30 to 40 million euro of Irish taxpayers' money. And those resources coming through the embassy here target the most vulnerable Ethiopians, those most marginalized, those who are the most poorest. We focus on development and humanitarian activities that relate to health, nutrition, climate change, governance, social protection, humanitarian assistance. So a huge breadth of engagement, but very focused on meeting the needs of those most marginalized and vulnerable. Ethiopia hosts a lot of Irish NGOs. They're present here. They've got very strong partnerships with government and with other local indigenous organisations. There's good relationships between Irish and Ethiopian universities. There's been over 100 Ethiopians have studied on scholarships in Ireland, and they return to contribute significantly and strategically to their own country's development, and indeed have developed strong people-to-people links between our two countries as a result of those fellowships. And, I'm delighted the other day I just saw off the fellows for this coming academic year, and the majority of which were women. So I was really pleased about that. And some focused on public health, which will incorporate issues related to our topic today. So there you go.
Super, really interesting and broad overview. And we look forward to welcoming those fellows on this side and to hoping to have some interactions with them as their year in Ireland studying goes along. It's very interesting that you talk about, just the links, that long history with Ethiopia and Ireland. And particularly as today we wanted to really focus on issues around nutrition and food. And like you say, I think for all of us, it's in our memory, the support and the connection and the solidarity between Ireland and Ethiopia, particularly around issues around famine, very much so. I wonder if, you mentioned that for Irish Aid, nutrition is obviously continues to be one of the priorities. Perhaps you could talk us through some of the major health and nutrition challenges that are facing Ethiopia today. That would be great to hear.
Great, Nadine. Yeah, I think important to start off by saying that over the past decade, and I'm sure our other colleague, Dr. Yared Abebe, will attest to this. Ethiopia has made significant progress in improving health outcomes. They've invested hugely in health systems throughout the country. But I think as well has been hugely challenged, like many developing countries and even developed countries, by what I call the triple C's. So COVID-19, obviously, from 2020 onwards, hugely challenging the gains in health and indeed the health system. So COVID, then there was conflict as well. Ethiopia experienced a devastating conflict in the northern part of the country over the last 2 years. We're very pleased there is a peace agreement in place, and we are now being able to turn our attention to repair a lot of the damaged infrastructure, to support a lot of the health workers who were displaced during that time, and indeed to try and get basic health and nutrition services back on track in many of those conflict affected areas. But the other big C was climate change. And obviously, again, there's been cyclical drought and flooding in many parts of Ethiopia. And that, again, challenges the health workers to provide services and indeed the infrastructure. So there's quite a lot of challenges there for Ethiopia. And again, of course, Ethiopia is an enormous country, 120 million people, 10 regions. It is enormous. And of course, there are regional variations in terms of what the challenges that Ethiopia faces. And there has been a lot of outbreaks of both communicable and non-communicable diseases, and it continues to pose challenges for our health system in Ethiopia. In recent years, it's been increasingly impacted by measles, cholera, malaria, and again, different regions affected at different times. And there is an increasing presence of malaria as well in upland areas, and that's most likely an impact of climate change. I think, and we'll get into more detail, I know, but Ethiopia has extremely high levels of malnutrition. And it is an underlying cause of child mortality, contributing to over 50% of death in young children. And this is exacerbated by conflict and not being able to access a lot of the services that should and would be available otherwise, and really, really challenging. I think it's fair to say that Ethiopia is ahead in terms of its policy framework and in terms of the strategies that it has in place to address these, but again, challenged in terms of implementation. And I think, we need a multi-sectoral response to address issues of nutrition, and that has always been a challenge across any country, and it's no different here in Ethiopia. So I think very, very challenging. I think Ireland, as you said, we have prioritised health system strengthening is at the core of our work. Looking at issues on food security and nutrition security is a key priority. And here in Ethiopia, no less, we continue to focus on those areas and provide support across to the government of Ethiopia's health system, and indeed to civil society organisations, both on the humanitarian response, immediate emergency responses to health and nutrition, as well as longer term responses. And then most recently, we're very fortunate that the Irish government made a commitment to address child wasting. So this was a commitment made last year at the United Nations, and our minister announced a commitment of 50 million euro for child wasting. And the Horn of Africa, which will include Ethiopia, Kenya and Somalia, will be in receipt of a portion of those resources. and it is to look at child wasting across those 3 regions. And that is being developed at this time. And we are looking forward to having multi-country, multi-sectoral interventions to address child wasting.
Well, thank you, Nicola. Huge food for thought there. I wonder, just picking up on some of Nicola's points, Marie, if I come over to you, I mean, you've got your extensive experience on health and nutrition, and I know particularly at the moment you're with the Emergency Nutrition Network. Could you say a little bit about the those links between health and nutrition, and also if you could circle back and just talk a little bit about child wasting, as that's such a priority. You could maybe just let us know what that is and why it's important.
Great. Thank you, Nadine. And delighted to be on this podcast and joining this conversation. And indeed, before I go into some of the details, it's really interesting listening to Nicola and reflecting, because although ENN that I work with is based in Oxford, we were conceived at a meeting in Addis about 26 years ago, and we celebrated just 25 years of being on the go. And we came out of a meeting where many people got together and said, how do we learn from each other? How do we improve what we do, build evidence what we do? So Ethiopia has a very, very special place in our heart. And indeed, it's through funding from Ireland that Ian then began at a desk at Trinity College in Dublin. And whilst we have our sort of administrative office in Oxford virtually, I think our heart and soul is in Ethiopia and in countries like it. And so we're very, very privileged through the network that we have to do the work that we can. I think, and when it comes to health and nutrition, they are intimately linked. And often we think of a malnourished or an underweight baby or child as having some problem with their nutrition, which often they do. And it could be access, it may be breastfeeding, it may be poor access to poor quality of food, diversity of food, unsafe food, but also maybe due to the fact that they may be sick. And they may be significantly sick and unwell, or they may be just not doing well. And it's a lethal combination of both. And it's so why the well-being of a baby and a child is so intimately involved in both health and nutrition. It's very hard to distinguish the two. One of the challenges we see is sometimes we just focus on nutrition, or we sometimes just focus on the health. And it's trying to get that integrated care for them both. I think when it comes to wasting, we hear the word wasting or acute malnutrition, and it's really when a baby is or a child is too thin. And we also hear the word stunted when they're not tall enough, or underweight when they're too small. So we have all these terms that are applied to these children, but really, we're really talking about children that are really more at risk of dying, more at risk of illness, more at risk of poor growth and poor development. And what we find across health and nutrition, we're all looking for the same thing, for these kids to survive. But it's not enough to have an ambition for not just surviving, because that means my child is not dead. And I think we all would want something much more for our own children, for them to feel it was an achievement that they're just not dead. So we want them to survive. We want them to thrive, to grow and develop. I think, again, just picking up on the great commitment that Ireland made on reducing child wasting at a global level. And within that, Ireland committed and put particular attention to infants under 6 months and their mothers who are wasted. And Ireland stood out in that commitment amongst all the global commitments of really recognising what a critical window that is for early prevention and sort of hardcore prevention and treatment of malnutrition in that age group, and particularly those wider infants that are not growing parity. So addressing infants who aren't growing well, and also looking after their mothers. So Ireland stood out in this and really is being quite championing in that regard.
Well, thank you, Marie. Just You're really taking us to the reality of the child and just what it is to survive and the challenges for a child to survive. And I know Nicola mentioned 50% of child deaths are related to malnutrition. And I was just reading earlier, I mean, that number is 270,000 children under 5 are dying annually as a result of malnutrition. That is just shocking. And I know that Ethiopia has some of the highest levels of chronic malnutrition, particularly as a network like the Emergency Nutrition Network. How do you go about addressing that, and what kind of programs are in place, interventions that are being implemented on the ground? And after that, I'm going to come to Dr. Yared just to hear more about that.
Yes, no, the burden is huge. And so when it comes to firstly the treatment, there are programs and interventions, and increasingly trying to integrate them within health systems to identify and to treat malnutrition, particularly what's often referred to as acute malnutrition or wasting, which carries the highest risk. And often those babies that are those children that are very thin and very small together is a bit of a particularly lethal cocktail. And so there are treatment programs that involves giving special therapeutic foods to children who are over 6 months of age, together with critical health care and support to the families. And because often what we see is, whether it's due to conflict or whether it's due to COVID or whatever, there's a hostile environment for these children. And so it's not enough to say, listen, we'll treat the illness or we'll give the food. You really need to have that supportive environment that actually keeps them in that good place and continues them in their support. There's increasing attention now, and, particularly including in Ethiopia, on prevention by getting in there early. And so that's, whether it's infant and young feeding support, whether it's multi-sectoral water and sanitation support, food systems and food security. So really getting in there early, preemptive. I think we also forget, when we talk about healthcare and systems of health, we always think of the formal structures like the outpatient clinics or the hospital. But most healthcare happens at home, and most nutrition happens at home. And so it's very much trying to really support the resources and then, what families do, what mothers do, what fathers do in their home, and how we can support them and prevent malnutrition, because it's such a high cost for very, very busy health systems and services. At ENN, we're involved in a research partnership with the London School of Hygiene and Tropical Medicine and Jimma University in Ethiopia and Goal, Ethiopia, to test integrated care for infants under 6 months and their mothers who are identified as growing poorly. And this is the first big trial that's happening in Ethiopia that's building critical evidence, which the Ministry of Health and the government and stakeholders in Ethiopia have prioritized and need and want, but also is a priority to global level. And it's a great example of how Ethiopia really is a bed of learning and has been a bed of learning, and showing the way when it's come to treatment of malnutrition in children over 6 months of age, and is now helping to lead the way for these infants under 6 months of age. And so what we're doing is trialing a pathway of care that actually is within the existing health systems, is working with existing health guidelines like integrated management of childhood illness, which is WHO-led guidelines, and is very much working with existing staff and systems, because it's so important for us to know not only what to do, but we need to know how to do it. And that comes down to the nitty-gritty of the particular context. And so in Ethiopia, there's critical work happening in that regard.
Wow, thank you, Marie. Some really important points, and something that struck me is, as you talk, we talk a lot about health system strengthening, because in the work of health, that's what we talk about. And I heard you mention systems of health, and just to, the difference with language matters. I'm really listening. The systems of health make me think about all the people and all the household, the community. It brings it alive, as does your description, when we're talking about, child wasting and child stunting. And then you talk about, a child who is not doing well, or a child who is thin. There's some really, really important differences in language. Anyway, it just struck me as we were speaking. I wonder, Dr. Yared, we really would love to hear from you and your experience. You're with Save the Children. We've such respect for Save the Children always, and the work that it does. What about, in relation to some of the specific challenges that have been mentioned by Nicola and Marie? What kind of work is Save the Children doing? What programs have you got in place? How are you addressing the challenges, and what are you seeing in terms of progress?
Thank you. So generally, as previously said, the contribution of malnutrition for presentable maternal and child death is enormous in Ethiopia. The specific contributors, for instance, for child death include intrauterine, growth retardation, micronutrient deficiencies, wasting, stunting. You can also consider inappropriate breastfeeding. It has some prevention advantage, breastfeeding as well. So it's a combination of these different factors that are contributing to the high mortality in the countries like Ethiopia. We shouldn't also forget about maternal nutrition when we talk about, the impact of nutrition, because, if you take Ethiopia, for instance, a quarter of mothers are anemic, with that being the most common indirect cause of mortality or maternal death, because, anemic mothers are likely to have negative outcome when they face complications like bleeding or infection and things like that. Also, micronutrient deficiency in mothers is also very, very common in this side of the world, where, it contributes to negative outcomes, including contribution to hypertensive disease of pregnancy, which is a second common cause of death in Ethiopia. We should also maybe recognize we are also facing double burden of malnutrition. 40% of deaths happened in Ethiopia due to non-communicable diseases, including diabetes, hypertension and things like that. Those are really associated with unhealthy diet as well. And what is more scary is also the trend. So fortunately, we have lots of global evidences, and policy-wise, we are really improving. We are getting more commitment in terms of having a nice multi-sectoral policy document. As you know, most of the undernutrition happens because of low intake or illness. But it's not as simple as that. There's a lot of reasons for that. Food insecurity, we have inefficient system in the food system. We have to work on that. Well, most of the families in Africa, for instance, based on food security and nutrition, global report, 75% of Africans, they can't afford nutritious diet. It's not about behavior change. It's not accessible. It's not affordable. So we need more, global commitment as well as national efforts to address that. So we are involving different sectors, including agriculture, education, because, ultimately it's about illiteracy, it's about gender, it's about service access, and it's also about access to safe water and sanitation. We need a lot of investment on different aspects, considering the multifaceted, complex causes behind malnutrition. So we need equally powerful strategies. And for that, we are improving in terms of having policies and strategies. And with huge thanks for donors like Irish Aid. We are having also good platforms for NGOs, local and international NGOs to work together for the common cause. For instance, we Ethiopians, we joined the Sun movement, the global scaling up nutrition movement like a decade ago. It's basically to join forces and reduce malnutrition in all its forms. So we, as ECSSN, we have a coalition with membership from more than 60 local and international NGOs where we share experiences, push on joint agendas, and be represented strongly in big forums and things like that. And the biggest donor we have for this initiative is Irish Aid, unreserved, generous support. And I really love to thank Irish Aid for this tremendous support. So with that, we have achieved, as said, like for endorsement of policy documents. Now we are also scaling up this coalition structures into sub-regions with that support as well, because it will be more meaningful down there. Because that obviously needs time and significant investment, but malnutrition cannot wait. We are losing lives, development potentials. And if we have to break, the cycle, we have to also interfere with short-term, mid-term strategies. That includes like treatment for malnutrition, scaling up other proven cost-effective strategies like vitamin supplementation, food fortification, with also community-level behavior change activities as well. So we are involved with different partners and donors in implementing, in supporting governments' endeavor on these directions. Right. And we are also excited to hear Irish Aid also coming with a very exciting opportunity with a wasting project as well. Very, very important. We are in the middle of drought now. We are responding.
Right. Yeah, because Dr. Yared, it's not only malnutrition, but also, as I heard mentioned earlier, food insecurity. And as we know, we know that there was a recent desert locust infection. Yes. Nicola mentioned climate change, floods. You're mentioning drought at the moment as they change season to season. And of course, that impacts the crop and the overall agricultural sector, as well as development aid and ability to support populations. And you also mentioned, you were mentioning women and children and pregnant women and breastfeeding women. And I just wonder specifically for those groups, I know it's a priority for Irish Aid and for the government of Ethiopia as well. What is Save the Children doing to reach the women, the children, those most at risk, particularly in the context of food insecurity?
Yeah, based on the evidences, we have to prioritize it. What in terms of target groups, mothers and infants under 2 years of age are prioritized with 1,000 days recommendation. So most of our programs, most of our investments focus on that age group when we talk about nutrition. So we have government programs already where nutrition services are integrated, which is very important for efficiency for countries like Ethiopia. So most of the services are delivered in integration with other health services. That's very important also from client-centered point of view. When they reach health facilities, they have to get a comprehensive support. So most of the maternal services, the supplementation, the nutrition counseling happens during antenatal care supports. Also, we do have community level pregnant women conferences where mothers join, it's like a group antenatal care where mothers share experiences and lessons. But unfortunately, malnutrition is still very common. It's very old. Most of in drought affected, conflict affected areas, screening services show that mothers and children are really malnourished. You can imagine a malnourished mother being pregnant, expecting to deliver. Those are a really big challenge for us. So in terms of coverage, service quality, we have a lot of work to do. So it's basically for sustainability point of view, we are building on supporting our governments initiatives in diverse directions.
Thank you, Dr. Yared. You've unpacked, I think that you missed nothing in terms of helping us understand just all of the different linkages between health, nutrition, development, climate change, but in a very relatable way. And Marie, I see you'd like to come in there. Yeah, we'd love to hear from you.
Well, Dr. Yared's reflections are really prompting lots of things in my head as I'm just listening. And I think that, how fundamental maternal nutrition and health is something that, again, is getting increasing attention in Ethiopia and globally. And that the health and well-being of a baby and child is intimately linked with that of the mother or prospective mother when she's pregnant. And mothers who are malnourished or poor health, they have the babies that are born too early and too small. There's much higher likelihood of that. And a baby born low birth weight today is an underweight baby or a stunted baby or a wasted baby. And then it suddenly becomes a problem in the system down the road. And so it's just another example of where we need to collaborate across nutrition and health. And sometimes when we use different language or definitions, we sort of segregate our thinking and we think we're talking about something different. And really is about a continuity of service that we're trying to achieve across nutrition and health, and also within health itself, because we also have that siloing that can happen where you may have programs that are looking at have under 5 clinics and you're treating kids that are sick and babies that are sick. But how do they link to the reproductive services that can see these at-risk pregnancies? So how do we have this continuity of care across them? And that speaks to the real need for collaboration and partnership, and Ireland's A Better World policy guidance policy documentation really speaks to this partnership and collaboration, which is at the heart of how I see and have experienced Ireland working over many, many years. And it's through support from Irish Aid to ENN at a global level that we are able to network and partnership and collaborate. And specific to Ethiopia, we have a Mami Global Network, which is this global collaboration across policy, research and practice. And we're now forming a chapter in Ethiopia, which is about working with existing systems, services, stakeholders to connect and collaborate around these infants under 6 months, which we fondly call as Mami. And that will help exchange within Ethiopia, but also help us to learn so that what happens in Ethiopia informs, we can amplify what's happening in Ethiopia. So I think it's a wonderful example, again, of this partnership and collaboration.
Yeah, and also just illustrates the importance of a network like ENN, and that function of actually networking lessons that are learned and experiences to be shared. And you mentioned A Better World, and Nicola, I just wanted to come back to you maybe on 2 points, just picking up on what Dr. Yared was saying. In A Better World, gender is a big priority, and particularly the focus on women and girls. And I just wonder if you could say anything about Irish Aid and how it supports the Productive Safety Net programme, which is about women-headed households. You might be able to say something to that. And also just to Dr. Yared's point about policy, how does the Better World policy, how is that working in terms of implementation, and how does it relate to some of the other policies that the government of Ethiopia have in relation to nutrition as well?
Great, thanks, Nadine. And you can probably see over my shoulder a poster on A Better World, and it's the one focused on gender equality, which is central to what we are doing here in Ethiopia. And I think, A Better World was launched in 2019, was impacted in terms of its implementation as a result of COVID-19, but it really pushing forward across the Irish government and through our international development and humanitarian response, a very strong focus on the SDGs, the furthest behind first, as mentioned earlier. There are 4 key policy priorities, which I'm sure your listeners are aware of as well, and focused on gender equality, reducing humanitarian need, climate action and strengthening governance, in recognition of the intersectorality and the complexity of issues that many countries are dealing with. in particular, here in our embassy in Ethiopia, we have adopted and are driving forward a very strong gender transformative approach. And that informs everything we do, from our diplomatic engagement to our humanitarian, our development, even our cultural engagement and our economic engagement. So we're very focused on the empowerment of women and girls here in Ethiopia. And just some of the manifestations of that relate to the policy environment. So we're working very closely with the government of Ethiopia on developing their gender policy. They're shifting from a women-focused policy to a gender equality policy. We're also developing a policy on gender-based violence, which to me is absolutely exemplary in the context where sexual and gender-based violence is increasing worldwide, including here in Ethiopia as a result of COVID-19, as a result of conflict. So we put that front and center stage, both from a policy perspective and also from a practice. So we're investing very heavily also in response programs and support for survivors of sexual and gender-based violence. In other areas that we're working, and particularly with Save the Children, I must say they're one of our very valued partners here, both on nutrition, but also in addressing some of the harmful practices that women and young girls experience, like female genital mutilation, child marriage. And in some regions of Ethiopia, the levels of FGM in early child marriage are very, very high. And obviously, they have huge consequences for health and nutrition, as we have highlighted. You mentioned there, Nadine, as well, the PSNP, the Productive Safety Net Programme. And Ethiopia is renowned on the continent, but this program is basically a social protection program focused on the most vulnerable households. And you mentioned there female-headed households, child-headed households. And basically it provides either food for work or cash for work. So people are involved in public works programs for food or for cash. The Irish government has supported this program over many years, including at its initiation. And it supports up to 8 million people in Ethiopia on an annual basis to meet their basic needs of nutrition, of getting support for their children to go to school. It's a huge program. And the government of Ethiopia is and should be very proud of it. It has been challenged in recent years as a result of the conflict, where the level of need is growing, a number of people in need is growing. And there is an effort to use this program and to be able to respond to certain humanitarian crises that happen on a cyclical or on an ongoing basis, and to be able to scale up the program to meet the needs of people who perhaps are relatively short-term as a result of a humanitarian crisis or an emergency situation. So there's a lot of work being done on the systems as well as on the response there. And Ireland have been to the fore in our support to the PSNP and in supporting Ethiopia in that regard.
Yeah. Thank you, Nicola. And I think it's just really interesting, just to your point around policies and a better world. It's great to see how those policies translate, how they're implemented on the ground. And I know, for instance, there's a kind of a cross-cutting, some of the themes in a better world are people, protection and food. And I think the conversation today really shows how that has come alive in the way that the support and the way programs are being developed. I wonder, Dr. Yared, I might come back to you and then perhaps to just to each one of you, as we come to the end of this fascinating conversation, just to learn so much, just to ask you, starting with you, Dr. Yared, what's the message that you might have, or if there's a call to action that you'd like the listeners to this podcast series to know? I mean, people listening here will be passionate about global health. They'll be passionate about creating a better world. What would be your key message or your call to action to them?
Yeah, thank you so much. So I have seen, the effort through this podcast and the initiatives and the cause behind that. That's very interesting. And thank you for selecting nutrition, which is always, hidden somehow, and usually not taken as an important agenda, despite it being linked to development, child right, equity, human right, basically, in development. So one message I have for organizations like you and all advocates is like we have to consider nutrition in all our efforts. One key thing we have to recognize is that like malnutrition is increasingly being concentrated in developing world, and the inequality is widening. We don't want that to happen, and we have to also recognize that the major drivers behind this, including conflict, climate change. We can talk about food price. These are all like intensifying. We need a global effort in addressing all this. There were very interesting global commitments with SDG, or as well as World Health Assembly, different other forums. There are interesting promises made by different organizations and countries. But I don't think those promises are kept, and we have to advocate for more, because the rate of decrease in terms of stunting, for instance, is not on track. We are not on track. And as previously said, for instance, food price, 74% of Africans, they can't afford nutritious diet. Yeah, we can't wait. We have to improve it. We have to transform agriculture in a sustainable way. So we need big global collaboration in this regard. And donors like Irish Aid, thank you for your support. Please support us on our priorities to break out of this cycle of poverty. And let's make a better world together. That's my message. Thank you so much.
A powerful message, Dr. Yared, and I really hear from you. We can't wait. A really powerful message, and thank you for that. Thank you for bringing us to the reality of why that's important, and also what specifically we can be doing. Marie, just coming to you, what would be your message to listeners? Something, a call to action, something you'd like to leave them with.
Thank you, Nadine. I think at a global level, when it comes to nutrition, we often home in on the big global targets, and we focus on the Sustainable Development Goal number 2 to eliminate hunger. But actually embedding nutrition in health is critical to achieving Sustainable Development Goal 3 on good health and well-being. And indeed, delivering on the nutrition one needs the health people, and especially for those who are furthest behind and are most at risk. And so across health and nutrition, we are all striving for the same thing, but it's a big task. And I think we'll be all much more powerful and efficient and likely to achieve what we want if we work together. And so it really is in all of our interests. And really, that's at the heart of Ireland's Better World strategy. And I think when you think of climate change and conflict and COVID, there's always all these things, and it can feel so complex, complicated, overwhelming. But these are all things that are just disrupting the systems, disrupting the systems of health and nutrition, both at a formal level, whether it's messing up the health services and creating excessive demand, and then at a household level. And I always imagine it a bit, it's like a mother and child are walking down a path, and then there's crosswinds coming and there's headwinds. You don't know where the next one is coming. And it's our job to make sure they don't keel over as they walk that path. And what's the coat they need? What are the waterproof trousers they need? What's the hat, so that they hunker down and they can face it. And this sort of resilience that we really want to build through prevention. And then when they start to kind of stagger, we're there to help a bit, but we're not there to substitute. They're the ones doing the walking. And so it's really looking at how we do that. And I think collaboration and partnership is at our heart of DNN, is at the heart of the work we do with support from Ireland. And it's what is driving forward the research in Ethiopia. Yeah. And so I'm really excited on what we're going to learn from Ethiopia.
Yeah. Oh, thank you. Thank you, Marie. You just said that so beautifully. I hear you echoing the message of Dr. Yared: collaboration, partnership, working together. And I'm sure, like all of the mothers and fathers listening, we can just see ourselves walking along a path, holding the hands of our children, being being moved by wins, and in that way, put ourselves in the shoes of mothers who will be walking with much stormier contexts. Nicola, perhaps last and not least, just coming back to yourself and asking you for your message in your capacity as ambassador and all your experience and the different areas that you're covering and supporting. What would your message or call to action be to people who are listening?
Thanks a million, Nadine. I think a lot has been said, and some of which I was also preparing to say, but it's great to have the last word. And I think kind of top messages from me or call to action is that everybody has a role to play. So that issue of collaboration, partnership, and I think what Marie was saying, sometimes it can be overwhelming, but everybody can play a role in this. And I think that's really, really important. And people can find where they are best positioned to play that role. I think remaining steadfast in committing to a better health for a better world, because it's a very long-term agenda. I think, yes, there is an urgency there, but it is a long-term agenda. So I think remaining steadfast in one's commitment is really important. So thirdly, every voice and actions matter. So I think really wherever a person sees themselves in intervening or working, just to make sure that from a policy and advocacy perspective, your voice matters. I think lastly, the call to action or message is keeping people to the fore of your response. So remembering that woman, keeping that woman's face to the fore, remembering that child, remembering that father, that mother, keeping them to the fore of your response. I think that came across very clearly. And sometimes you can feel quite removed from that, depending on where in the world you sit, but keeping those people to the fore, those who are most affected, most vulnerable, is hugely important. So thanks a million.
Thank you so much, Nicola, and thank you for your role in being such an eloquent and skilled ambassador for all of us in Ethiopia, in all of the good work that you're doing. We really appreciate it. And Marie, thank you so much for sharing your expertise, and Dr. Yared for just bringing everything very clearly into focus in terms of the importance of malnutrition. So thank you all.
And that brings us to the end of another enlightening episode of Better Health for a Better World. We hope you enjoyed our exploration of the remarkable global health projects and programs supported by the Government of Ireland. Remember, by investing in the health and well-being of communities around the globe, we not only create a better world for those in need, but also foster a more interconnected and compassionate planet. We encourage you to stay engaged and to take action, as each of us has the power to make a difference. Thank you for joining us on this journey towards better health for a better world.